Let's get more on how this can happen. Let's turn to Dr. Sanjay Dhall. He's the chief of neurosurgery at the Harbor UCLA Medical Center. Thanks, doctor, for being with us. How unusual is it to hit your head in a way that doesn't produce immediate symptoms and then just go to bed, think nothing of it, and then it leading to such a devastating and unexpected and sudden death in a patient?
Well, thank you, Hala, for having me. And absolutely, that's a great question. And certainly, we in the neurosurgery community don't want to create alarm that any minor trauma could always cause such an awful consequence. But it is something that we do see more frequently than is expected. And certainly, we see this more and more in people that are aging and people that take blood thinners, that even a seemingly minor trauma can cause a life-threatening hemorrhage. And usually there are some warning signs, especially if they're with family, who might notice that something is wrong.
Yeah, and what are those warning signs?
So when we see patients like this, if there's someone with them, they might notice that they're becoming drowsy or confused, or they might have a severe headache. And certainly we often counsel our patients if they're taking blood thinners, and there are many medical reasons why people need blood thinners, that those kinds of symptoms are even a greater cause for alarm. And it never hurts to seek out medical attention when there is a concern like that.
Because, I mean, in a hotel room, it's not like being on a ski slope or getting in a car accident. I mean, ultimately, where do you bump your head in a hotel room? On a cupboard door or, something like that. And we've all done it. So how, if we're alone, can we look out for ourselves? Is there a way?
Yeah, and that's what's so disturbing about it. It's different from the Natasha Richardson case, where there was a high velocity injury that was suspicious, or other, like you suggested, car accidents. The vast majority of the patients that are elderly or on blood thinners that we see with these kinds of head injuries are usually exactly this kind of trauma, if you want to even call it that, which is a very minor bump of the head. And that's where we're grateful in those scenarios when those folks are with someone else who notices that something is wrong with them. Unfortunately, in this case, for Mr. Saget, it seems like he was alone in a hotel room, and there very well may not have been anybody there who could have noticed that he was declining and needed medical attention. And it's a very sad tragedy that it worked out that way.
So if you notice after someone bumps their head that they're becoming confused or that they're becoming drowsy, do you then immediately call emergency services, or do you wait and see if it gets worse? What's the best way to go about it?
No, I every single time I would call 911 or get somebody to a hospital immediately if they're confused or inappropriately drowsy, regardless of age, after hitting their head. It's certainly something where time really, really matters, and every minute and every hour make a big difference. And so we would want to get them into an emergency room and get them evaluated as soon as possible. And we'd rather have someone be all right than miss something terrible.
Sure. But so how do you then, what do you do when someone comes to you with these symptoms after saying, well, it was just a small bump, but my husband, my brother, my son, whatever, is confused? How do you then decide whether or not it's a life-threatening problem?
Yeah, and that's a great question. And nearly every major hospital has a CAT scanner or a CT scanner, which is a very quick and rapid way to get images of the brain and see if there's bleeding, especially large life-threatening bleeding, like probably had happened here. And it can be done very quickly in an emergency room. And then when they find something like that, they can get a neurosurgeon involved and we can intervene. And if we get to someone early, we can have really amazing saves.
Oh, that's good. So time is of the essence. Thanks so much for explaining some of this to us, Dr. Sanjay Dhall. Really appreciate having you on the program. Thank you.
Thank you very much for having me.